Well, joining me now is Jeff Colyer, former governor of Arkansas, and now running to become the next governor of Kansas. My apologies, Kansas. Governor, good to have you with us.
You know, we call it our Kansas up here rather than
It's
Arkansas.
that river that runs through Wichita. It's the river that runs through Wichita. Gets me every time. Well, Governor, let's rewind and start again. We're excited to have you on. You did a terrific job in your first term as governor, and I know you want to be governor again. And we're going to get to that in just a moment. But I know that you've got some really inside knowledge or some interesting knowledge about cancer. You are also a doctor. What do you make of what we've learned over the past 48 hours now?
So I'm a surgeon, and as a surgeon, you know, I'm concerned about treating my patients. I, too, had prostate cancer about 3 years ago. I left the political world, got my cancer taken care of. I had surgery, and as we surgeons say, the chance to cut is the chance to cure. And so I'm a surgeon. I've done very well ever since then. But I am shocked, utterly shocked, that the most powerful man in the United States is diagnosed with advanced metastatic prostate cancer. That's something that should never happen in the modern world. You know,
it's really staggering. Yeah, it's really staggering, Governor. And I know CBS had their medical correspondent on earlier today, and they said, well, it may have been that because he was so old that they decided not to do those procedures. It seems to me if you're president of the United States, you should have access to the best medical treatment in the country.
Of course he has access to the best medical coverage in the world, for that matter. You know, I think it's a huge problem. I'm actually posting on Twitter the medical reports of Obama, Trump, and Biden. And what's shocking when you see Biden's reports is there's no physical exam of his genitourinary system, and there's no PSA testing. Now, they're starting to say, well, it wasn't being recommended by the task force. But when you read the document says that older men, that says maybe men over 70 should not be tested unless it is appropriate. And in Biden's case, of course it's appropriate. It would have been something that it would have a tremendous impact. And so I've actually posted online all of the presidential PSA reports and their physical exams over the last 10 years or so. President Obama's, President Trump's, President Biden's. And in those, Obama and Trump, they had their PSAs tested, and they also had a genitourinary examination. However, when you look at Biden's, there's nothing. It's silence. Now, that to me is bad medicine at the least, or maybe it's a cover-up at worst. I don't know.
I want to go to some statements here. House Minority Leader Hakeem Jeffries, here's what he had to say.
It seems to me entirely inappropriate that at this moment in time, when President Biden is dealing with a serious and aggressive form of cancer, there are Republicans who are peddling conspiracy theories and want us to look backward.
Okay, first of all, Jake Tapper and Alex Thompson are not Republicans, nor are they conservatives, Governor. I find it very interesting, though, the timing here. This announcement coming out 2 days before this devastating book about the cover-up.
You know, I don't know what's behind all of this and why the president didn't get the care that he deserved, or frankly, that any American deserves. The data is very clear. If you go, there are studies that show the autopsies of people between the ages of 70 and 79. And 33%, 1 out of 3, have prostate cancer. It may not have been what would kill them, but they had that cancer. So clearly this is something that is at risk for the president of the United States at his age. And if he had it, the impact on the country is huge. You know, and so I'm just incredibly saddened that they did that. And I want the president to get the best care. You know, one of the things is when you look at these reports, they talk about the Gleason score. Well, actually, Gleason scores fell out of favor 15 years ago in 2011. If you go and have a second opinion on your Gleason score, it's turned over 49% of the time. That's roughly a coin flip on whether your Gleason score is correct. What we did in my case, and what is the modern way of doing it, is you have genomic testing of the president's of his biopsies that he had, so that you know what the right treatment is going to be. And I want the president to get the right treatment. And a lot of times you don't hear about it, but having this genomic testing and having first-rate care is absolutely appropriate.
All right, Governor, we're going to have to leave it there. We're going to get you back on. And again, running to be the next governor of Kansas, Governor Colyer, always great to see you. Thank you for coming on Newsmax.
It's always great to see you, my friend.